Sir, firstly, thank you for being associated with Healthcare Product Summit 2020. And before we go forward for anything, I just wanted to know how is your experience so far with us in the summit, in the conference?
Good afternoon. Thank you for inviting me here. This is a fantastic opportunity. I would say outstanding, game changing, awesome sauce. These are some of the words that come to my mind when I see some of the entries for this year awards and the participants. I have met a few I've met a few exhibitors so far, and I would say the fantastic range of technology that is coming to healthcare for the benefit of patients and the community. We have people who have artificial intelligence for the diagnosis of diabetic retinopathy, for example. You have something called Nadi Pariksha device for Ayurveda market. You have CardioTrack, which is a 12-lead ECG for remote diagnosis of heart disease and irregular heart patterns. So the list goes on and on. It's a fantastic opportunity for me to be here.
Yes, sir. Sir, the theme that the conference revolves around is let's rethink health and care. And how do you think AIG is in this space of rethinking health and care? And how is this hospital associated with this theme?
Great question. So AIG Hospitals is a fairly new hospital. It's a multi-super specialty hospital with more than 800 beds. We are located at Gachibowli, Hyderabad. And we also want to rethink healthcare and redefine healthcare. You see, the problem is most people in India, they want to achieve and they want to access the best of healthcare services and healthcare delivery. Unfortunately, good quality corporate hospitals become a little unaffordable for the masses, and that is where I think we are making a big difference. Our services are world class. Our doctors have the best of international exposure and experience. We have tie-ups with doctors who are working at Harvard and Stanford. We have recently entered into a collaboration with the Mayo Clinic of the USA. Despite all this, we are still so affordable, you'll be surprised. So we are the only hospital perhaps that have a comprehensive focus all around on not just clinical excellence but also academics and research. And that is a three-pronged strategy to deliver the best of healthcare in India.
Right, sir. Sir, again, coming back to the conference theme, having the promotion about the health rather than having it after being sick, how important do you think it is? And again, what is AIG's role in it?
Very nice question again. If you see the rise of non-communicable diseases, NCD for short in India is on the rise. We are sadly the diabetic capital of the world, the heart disease capital of the world. Breast cancer, lung cancer is on the rise, every day. So prevention is definitely better than cure. By the time you reach a hospital, unfortunately, you're already sick. You have been diagnosed with late-stage disease, and sometimes the doctor is so helpless, despite the best of technology that we have at our disposal. So every human being, it doesn't cost much to go for the preventive health checkup every year. Just once a year, hardly 2 hours of your time. I don't think that's too much to ask for maintaining good health. AIG has a range of very good standardized health check packages, but also differently, we also do what is called customized health screening. Depending on your individual lifestyle, your family history, risk factors, we design a customized health checker package, which is suited for you only.
One last question, sir. Like, how are you in the space of educating the patient about all this, sir? Like we spoke, preventive measures are definitely important, but how are you educating your patients or the patients you already have or the new patients who will be touch basing with you? Yes. So, what's your role in that?
People, the common man, patients, the public, they're very net savvy today. Everybody has a smartphone, everybody has a WhatsApp account, they are on Gmail, but they don't really look at healthcare information so much, as you may agree. But yes, we do a lot of work online to disseminate preventive, health tips and practices. We also do community events. We go sometimes to residential communities and complexes, to corporate parks, and we have various kind of training programs, educational programs, including health talks. For example, recently we went to a big IT park in Gachibowli, and we trained them on what is basic life support and how to deliver CPR. If somebody is unconscious, how do you identify whether he's actually dying, whether he's just choking, or whether he's maybe dying of a heart attack? How do you identify the signs and symptoms? How do you give resuscitation on the spot? So that is how we educate the people with a high level of human touch with our doctors and marketing team actually.
Great, sir. I think the discussion can go on and on in this preventive space. And we are very happy to have you associated here, sir, in Healthcare Product Summit. And we are also glad to know that AIG is into the space of rethinking healthcare once again. Thank you so much,
Thank
sir.
you so much for the time. My pleasure too.